When pursuing a career in nursing, my motivation stemmed from growing up with parents who worked in the field, and hearing their experiences, both positive and negative, sparked a passion within me to make a difference in people's lives. I have always been drawn to caring for others and making them comfortable, especially in difficult situations. To ensure this career path was right for me, I worked as a healthcare assistant, and through this experience, I confirmed my desire to become a nurse. I am eager to follow in my parents' footsteps and contribute to the team. As a nurse, safeguarding is essential, and it entails protecting citizens' health and rights. It is a collective responsibility to safeguard children, young people, and adults. And as a nurse, it is my duty to protect patients and the community from harm. If I suspect any form of harm, such as physical, emotional, sexual, or financial abuse, I must report it to the relevant authorities. The concept of the 6 C's of nursing, care, compassion, courage, communication, commitment, and competency, is vital in nursing. And the one that resonates with me is compassion. As a nurse, I often encounter patients at their most vulnerable moments, and although I may not fully understand their experiences, I always strive to treat them with kindness, empathy, and compassion, just as I would want to be treated if I were in their situation. Mistakes can happen, even to the most experienced nurses, often due to fatigue or momentary impairment. However, it is how one learns from these mistakes that matters. I recall an incident during my training when I made an error in calculating the drip rate for a patient's IV, which was supposed to be infused at 100 milliliters per hour but was instead calculated at 200 milliliters per hour. I quickly rectified the situation by changing the IV bag and recalculating the drip rate. And I also spoke with my proctor to understand where I went wrong. This experience taught me the importance of double and triple checking my calculations to ensure accuracy. Working with challenging patients is inevitable in nursing, and it is through these experiences that one can grow both professionally and personally. I once had a patient who had suffered a traumatic brain injury and was unable to communicate verbally, which often led to frustration when I did not understand his needs. However, over time, I developed a better understanding of his requirements, and devised a communication method using flashcards to help him express himself. This patient taught me the value of critical thinking, patience, and creative problem solving in nursing, and our interaction helped me develop into a more empathetic and resourceful nurse.